Can't you see the sunshine? Can't you just feel the moonshine? Ain't it just like a friend of mine who hit me from behind? Yes, I'm gone to Carolina in my mind.
My name is Mary Lou Affronti. I'm a North Carolina adult nurse practitioner and a doctorate of nursing practice student at Duke University School of Nursing. Today, I would like to advocate for nurse practitioner autonomy as a solution to improving access to health care in North Carolina. Many North Carolinians may be unable to access health care due to the increase in aging population, the additional 750,000 expected to gain health insurance by 2014 under the Affordable Care Act, and the decrease in the number of physicians choosing primary care. But will North Carolina have enough primary care physicians? The North Carolina Academy of Family Physicians projects that North Carolina will fall short by 2,000 family physicians by 2020. And North Carolina will only have 75% of the number of family physicians needed. 70 of the 100 North Carolina counties are rural. Many rural North Carolina counties do not have enough primary care physicians. Since 1990, the number of medical students choosing to become primary care physicians has steadily decreased. North Carolina's SHEPS Health Research Center reports that fewer than 2% of medical students practice primary care in rural North Carolina. One solution to the poor access problem is to utilize the increasing number of approximately 4,000 North Carolina nurse practitioners to their full capacity. Nurse practitioners are licensed advanced practice nurses who are board certified after 2 years of education at least a master's level. They are educated and trained to provide primary care, diagnose a range of illnesses, manage chronic problems, prescribe medications, and refer patients to specialists when needed. 4 years of data from 6 North Carolina graduate nursing programs reveal that 50% of new nurse practitioners worked in underserved areas where primary care physician shortages exist. So what is the issue? Regulations of nurse practitioners vary across the United States. Unlike 27 states and the District of Columbia, North Carolina law requires nurse practitioners to have restrictive collaborative practice agreements and physician supervision, even though NPs have been trained to provide primary care and refer to specialists without those restrictions. North Carolina does not allow NPs to practice autonomously or to own and operate a clinic unless they have a contract with a physician to oversee their work. By North Carolina law, they can hire a physician to oversee their work, but in many North Carolina counties, there are no physicians present to provide the required supervision. Many NPs would gladly work in rural, underserved areas if that hurdle did not exist. Now let's speak with Leslie, a rural North Carolina family nurse practitioner who has practiced over 13 years in rustic Pittsboro and will eventually lead her own clinic. What are your thoughts about autonomous nurse practitioner practice and the ability to improve access to care?
The Affordable Care Act has really started momentum rolling because it is focusing on patient care access and getting more patients insured, getting them the health care that they need. I think that autonomous practice will help nurse practitioners to get out in the communities that they are needed in. I think that right now there are nurse practitioners who have tried to open practices in rural communities. They have had difficulty locating a primary supervising physician, and if that physician were to stop suddenly, it leaves the whole entire practice in a bind. I do think it will improve healthcare. I think we are offering solutions. Nurse practitioners are not the solution to a physician shortage. We are providing increased access to clinicians who are able to provide excellent high-quality primary care.
Leslie, will collaborative practice decrease if the contractual physician-NP agreement is removed?
I don't think so. If there were ever a patient that I were unsure about, I would consult with whoever I needed to provide safe care. Just as a primary care physician would have to refer appropriately, so would I as a nurse practitioner.
As Leslie has indicated, unnecessary physician supervision prevents many NPs from practicing to their full capacity, especially in rural settings where there are few or no physicians. A landmark Institute of Medicine report on the future of nursing recommends the removal of regulatory barriers that keep NPs from practicing to the full extent of their education and training, and the removal of the restrictive physician-NP collaborative agreements that reduce access. Do nurse practitioners provide quality care? Research shows that autonomous nurse practitioners deliver safe and effective care. 4 decades of evidence, including systematic reviews, demonstrates that NPs can provide high-quality, autonomous care that is at least equivalent to the care provided by primary care physicians, with some studies showing that NPs can provide better control of diabetes, cholesterol, and blood pressure. There is no significant difference in claims against NPs in states with restrictive practice compared with states that do not require NP supervision. In conclusion, no data suggests that restrictive NP practice improves patient safety or care. What about cost? Autonomous nurse practitioners can be deployed rapidly and are cost-effective. Underutilized NP services in the United States are estimated to cost approximately $9 billion a year. A 1996 military healthcare reform found that using autonomous NPs was a rapid, cost-effective solution that increased access. The Congressional Budget Office showed spending under NP care rose more slowly than for physicians. North Carolina physician supervision costs are poorly documented, but anecdotal evidence suggests that removing physician supervision could save the state $12 million a month. The critical North Carolina primary care access problem has serious implications for our citizens, especially for the aging and chronically ill who live in rural counties. I am advocating to remove legal barriers that currently do not allow nurse practitioners to expand their roles and take full advantage of their education, skills, and experience in order to mitigate North Carolina workforce shortages and improve access to care. Nurse practitioner autonomy is a solution to improving access and based on policy recommendations grounded in decades of evidence concluding that autonomous nurse practitioner care is efficacious, safe, and cost-effective. Fully utilizing all providers can improve the access of our North Carolina residents to safe and quality primary health care.